And let's look first at the science behind Belotero, about technology, rheology, and filler performance. You all know, because you're using Belotero for quite long, Belotero is a range based on the so-called CPM technology, cohesive polydensified matrix technologies. Meanwhile, especially in the European Union, we still have more than 250 different fillers. We have, I think, about 100 different hyaluronic acid claimed technologies. Many of them are copies of each other, but CPM technology is unique. Why? Because the first three steps, the mixing of hyaluronic acid chains that every manufacturer receives as the powder with water basically, this is in common for all AJ fillers. Even in this first step, there are some differences. Some AJ fillers use only high molecular weights HA, some use low molecular weights predominantly and a little bit less of high molecular weights. Some of them have 50-50 or something like that. So even these first steps, how is the length of the hyaluronic acid change when the manufacturer receives that is different. And then we all know what happens when you put it into the water. The hyaluronic acid chains are stretched, and then we add BDDE. Most of the AJs have BDDE. There are just others that use some other molecules, but are still microplastic, for example, and synthetic, like PEG. But also there are some that use thermal cross-linking. But most of the AJs that we have on the market are based on the BDDE cross-linking technology. For most AJs, here would be the stop. However, in Belotero, in CPM technology, we have two more additional steps. So now you have to imagine after the first cross-linking step, we have a kind like a spider web. It's a net because the hyaluronic acid chains are connected to each other through the BDDE molecules. What happens the next? We want to have different hyaluronic acid fillers with different concentration, different density, different cross-linking degrees. But how can I bring it all in one molecule? So through the specific manufacturing process, at a certain parts of this big net, hyaluronic acid additional chains are brought into it and additionally cross-linked. So in the end, we have a specific mesh graph, a specific network of hyaluronic acid, three-dimensional structure that has some areas with higher concentration and higher cross-linking degree, and some other areas in this network with lower hyaluronic acid concentration and lower cross-linking degrees. But it's all in one three-dimensional network, and therefore it's polycohesive and polydensified matrix. Why do we need that? Yeah, we have certain areas where we want to have better projection capacity, longer lasting results, better filling effect, and so on. So here it would be of advantage to have higher concentration, higher cross-linking degree, longer duration. But we also have some other areas where we don't want the filler to be visible, that needs to sneak into our intradermal and subdermal structures between the connective tissue. And here we need rather low density. And if we want to squeeze AJ filler through small needles or thinner cannulas, in cannulas I do not recommend that, but if you're using a needle, I recommend the smaller needles, then you need a product with rather lower density or a good mixture of high and low density characters. So based on these different manufacturing processes, how many zones do I have? How high is the final concentration of hyaluronic acid? How big is the cross-linking degrees, and how big is the ratio between a high density and the low density zones? This is how the entire Belotero range is produced. From Belotero Revive, that's the only one that doesn't contain lidocaine at all. The others you can have with or without lidocaine. That has just very low cross-linking degree, low concentration, or 18 milligram per milliliter, additionally glycerol, up to Belotero volume that has the highest concentration of 26 milligram per milliliter and the highest cross-linking degree, highest G prime, and so on, and we will come up to it. But why do we need all of different AHAs? Even not just for different indications. Because to be honest, sometimes in nasolabial fold, even just a simple nasolabial fold, I would inject everything between Belotero balance, even soft, up to Belotero volume. It all depends on our individual assessment and individual patient needs about their skin quality, about their 5 layers anatomical structures, which product I am going to choose. Because basically I could use everywhere any of them, but I have to understand how they work and thereby perfectly individually meet patient needs. So I already mentioned all AHAs are produced differently and they all claim to have unique cross-linking procedures and different names for it to make it for us very complicated. And this is really the truth. As I said, some copy each other, but they are not the same. So basically we could say that due to the manufacturing process that is unique for every AHA filler, when we look under the microscope, and then you can take a petri dish, a little bit of your filler, a little bit of ink, and a little bit of water, and just check it. Every AHA filler looks differently. It's like fingerprints. We all have different fingerprints that can identify us as a unique individual. That can happen with hyaluronic acid like that. Some of them are rather particulated, with the particles of the same size, same shape, very homogeneous, but particulated. Some of them are particulated, but the particles are very heterogeneous in size, in shape, in staining, and staining stands for the concentration basically and the cross-linking degree. And when you look at the CPM, cohesive polyidentifized matrix, the word matrix is represented what you see in the microscope. You don't see the single particle, but it's all like one network. It's all connected to each other and it's all sticky to each other. That represents the cohesivity. And what we would see under the microscope in vitro, so to say, we would also see in vivo. If we inject different hyaluronic acid fillers, for example in this case intradermally, CPM, Hyacross and Nasha technology, what you see under the microscope in vitro is exactly what you see regarding the distribution and the integration of AHA in the deep dermis. The same is the case for Hyacross and CPM. So here, according to the Hyacross in vitro, very heterogeneous, particulated, particles of different size, different shape, different concentration. This is what we see intradermally as well. And in this case, we even see that the distribution also, of course, has an impact on immunological response of our own tissue when a foreign body, and that is what it is, hyaluronic acid is injected in the tissue. The more heterogeneous, the more irregular something looks like, the easier it is to be recognized by our immune system. This is a general rule in immunology. If I have hyaluronic acid that will imitate my own tissue, my own hyaluronic acid, that will sneak and squeeze into the smallest dermal gaps and fill those that our natural hyaluronic acid would do, the lower the chance and the risk that immune response would recognize it as the foreign body and react with lymphohistiocytic infiltration, plasma cell infiltration, and the anti-cascade of the immunologic reaction. And this has been shown actually a long time ago. This is publication of the German plastic surgeon from Cologne, so very close to Benelux. Already in 2009, 15 years ago now, injected different, in total these were 11 different AHAs. I'm just showing here 4 of them, that the manufacturing process influence the distribution of the AHA and influence the immunologic response of our immune system to hyaluronic acid. So for example, CPM AHA, that is shown here, has a minimum to almost no lymphohistiocytic infiltrations, where some other AHAs that we have here, like for example Theozial deep lines, here I see it, so this is the old range, not the RIJ, shows very massive inflammatory response with strong lymphohistiocytic infiltrations, with plasma cells, with foreign body granulomatose cells. And the same is not just for intradermal injection, because actually basically in the last 10 years we have moved more and more from intradermal injections towards the subcutaneous injections, either into the deep fat compartments or in the superficial fat compartments. And when we look here at the comparison of the volumizing ViaCross to the volumizing CPM, then we see that the volumizing ViaCross injected into the subcutaneous tissue, we have much higher lymphohistiocytic infiltration, much more immunologic noise than, for example, with the volumizing CPM. The more immunologic noise, the more lymphohistiocytic infiltration, the more foreign body giant cells we see in the tissue, we know the higher risk that the patients develop inflammation that might result in inflammatory nodules, red angry bumps, or even in granuloma, but granuloma is the histologic diagnosis, whereas all the others are clinical diagnoses. This manufacturing process not only, as I said, influence distribution in vitro, how the filler looks like, distribution in vivo, what we see in the microscope, we see in the dermis and in the subcutis, and also immunologic response. But of course, the manufacturing process also influences the rheological properties. And I'm not going to bother you too long, but the rheological properties actually, if we understand them, makes us able to treat every patient individually. As I said beginning, forget what they tell you. This is for the nasolabial fold, this is for the tear trough. We can use everything everywhere, but we have to understand why, when, in which patient, with which injection technique. And basically, there are 3 up to 4 pillars of rheology that influence all of these clinical applications that we might use in our patients. That is the cohesivity, how sticky is the product, how attached to each other the molecules are, or will they stay attached, or can I split them, can I disturb their network? Then of course the elasticity, is this three-dimensional body able to resist the pressure, or will it be, when I press it, it stays squeezed, or will it return to the spheric shape, for example? And of course for us, where we want to work a little bit like artists and sculptors, how is the plasticity? But you can't look just at one single parameter, and another parameter is the viscosity, that means how easy is it to spread the product, and how actually hard is the product. And I will speak a little bit more about that into detail, but they are all influencing each other. So you can't ever go too much just on one side, because it would be imbalanced. So the cohesivity, elasticity, viscosity, and plasticity need to be fluent. They need to be in harmony and balance, and only then they will be easy and well tolerated by the immune system. So therefore, as important as the cohesivity is, it is important to look at the viscosity, elasticity, and plasticity. And I know how many times some sales reps come to us and say, oh, but my product has the highest viscosity, my product has the highest cohesivity, my product has the highest elasticity, and so on. But it's never just this one single, because all of them, they influence what we do in daily practice. Injection technique, injection depth, and of course also the efficacy in our patients that influences the satisfaction of our patients. And this is what is important for us. So when we look at the Belotero range, that we can say the products that have the highest cohesivity and therefore the lowest G prime, so the lowest hardness and also the lowest viscosity, are Belotero Balance and Belotero Soft. The product that has a very high cohesivity and a moderate G prime, and therefore is very elastic, that would be Belotero Intense. The product that has the highest G prime but the lowest cohesivity of the Belotero range is therefore having a good projection, but it's rather moldable and not that sticky because it's not that cohesive, is Belotero Volume, for example. So what we can summarize about this very technical, very theoretical part, is that CPM technology can be described, if you want it very well, as a biomimetic design. What it means, you all can actually associate the words with the proper meaning. Mimics means to imitate, and biomimetic to imitate natural body's own, host's own tissue and the behavior of that tissue. That means Belotero range is characterized by the unique cross-linking process. But due to this unique cross-linking process, it results in polydensified, polycohesive matrix. We have these very balanced rheological properties between cohesivity, viscosity, elasticity, and plasticity. And this results in a most natural distribution, integration, and tolerability in the tissue, and in the most natural results. Doesn't matter if you look at rest or dynamic motions and stress and so on. Of course, if injected properly and in a proper amount, this is always our job. But we can say to our patients, the CPM technology biomimetic design is actually mostly like your own hyaluronic acid, like your own tissue, because we inject it also into the fat.